Good afternoon and welcome to this program brought to you by BBC Africa. It's now 4 months since the first case of COVID-19 was confirmed in Africa. It started in Egypt and now every country in the continent has recorded a confirmed case.
A number of African countries have imposed various prevention and containment measures against the spread of the disease, from lockdowns to curfews to social distancing, and recommended best sanitation practices like frequent hand washing or using sanitizers, wearing of protective kits like masks, self-quarantine and testing.
However, in a continent where more than half of the population lives in rural areas with limited access to water and sanitation, health facilities and information, are these measures practical and not more needs to be done to protect this population from the pandemic? Welcome to the program. My name is Rodo Diambo.
And I am Fatia Mohamed Noor. Today we're going to have a very interesting discussion, don't you think so?
Yes, we are. And to help us steer this discussion forward, we are joined by Dr. Catherine Chobutunji, who is the Executive Director of the Africa Health Population Research, and she's based here in Nairobi, Kenya.
Yeah, and we're also joined by Mr. Shobi Jiwa, who works for a community-based organization in Malawi that is called our AIM Foundation, that works with rural communities to provide food, water, and sanitation. Thank you for joining us, to the guests.
And we already have some comments here from people who are joining us. We have Addison Okeke from Nigeria, who says that some African countries like Nigeria started implementing containment measures at a very early stage of transmission, yet they experienced the rising case figures. What is responsible for this? We also have Dominic Lual in Grogol, South Sudan, who says that these measures are not all inclusive and equitable in my country. Even those living in urban centers do not have enough, leave alone rural communities.
I think we're going to have a very interesting discussion. But first, why the rural population, you may ask? Here is why. The United Nations 2018 report shows that 59.8% of the African population lives in rural areas where poverty and illiteracy is high. Almost 3/4 of that population likes piped waters. This means they have limited access to water and sanitation, which is vital for frequent hand washing. Also, most of the testing centers in Africa are located in urban areas, and this limits the rural population access to testing and health facilities.
And we followed a family in Western Kenya to try get a sense of what they have, how to achieve frequent hand washing. And we seem to have a small technical hitch. Let's start off with our guest. If you're able to get Dr. Catherine Chobutunji or Mr. Okay, thank you so much for joining us once again. And I'll start off with you, Dr. Chobutunji. Why is it important for governments rather, to be able to reach out to rural populations, especially during this pandemic?
I think why it's important is that the government has to be careful about how transmission happens, and governments cannot afford to neglect certain populations or certain corners of the country, because if any part of the country is neglected, that could be the source of another outbreak that can progress unnoticed, out of control. And of course, as you've said in your introduction, most African countries are predominantly rural, so you need interventions that actually affect everyone in the country, and not to focus all your efforts on urban populations and forget the rural ones who ordinarily, even outside COVID, are disadvantaged in many respects.
Right. Interesting. Mr. Shobi, just to come to you, do you think the rural population is well equipped to prevent and contain the virus?
Thanks for having me. I don't think the rural population are actually equipped with the right test centers or anything that links COVID-19. We do have the DHO, which are the district health offices that are linked in a network with the main sector in town centers. Communication-wise and in terms of all the clinics around the rural areas do report to this district health commissioners. So if there are any symptoms linked to COVID-19, communication goes through to the DHO, and then the DHO communicates to the actual centers and help is sent. So I will disagree that no, there is no adequate help for the rural area.
So still staying on with you, Mr. Shobi, then what does your organization exactly do to, help the rural areas in terms of what the pandemic is doing now?
Our AIM Foundation has chosen an area called Mchinji, which is actually bordering Zambia and Malawi. We're literally 10 kilometers away from the border. And because Malawi was one of the last countries in Africa to actually have the pandemic cases, we knew that Zambia and the neighboring countries already had active cases. So we, as our AIM Foundation, went to the village and created awareness within the chiefs. The chiefs of the communities actually got involved. Our AIM Foundation, have a woman empowerment center with 60 ladies that sew reusable sanitary pads. So we actually transferred this concept to making masks. And what we've done is all the 60 ladies actually stitch these masks and distribute 80% of the masks across to the villages and its neighboring villages. We have over 126 remote villages around our AIM Foundation clinic. And all the 126 villages have 126 chiefs who are trained to actually create an entry and exit system within the village. As you are aware that all the villages have one systematic road that crosses through them. So what we've done is we've basically created barriers in every village, and every person that enters the village has to forcefully wash their hands, make sure that if they don't have a mask, they are given a mask. And as they go across to the other village, the same chief on the other village will make sure that these things are carried forward. So we have tried, as our organization, we've tried to spread this towards the southern area of Malawi, Mchinji, and we hope that this actually spreads everywhere in Malawi.
So right now, we're going to watch a clip from Western Kenya of how people living in those areas are able to ensure that they prevent themselves from getting COVID. So Dr. Chobutunji, from what you're seeing, what do you think of these measures that these people are putting in place?
I mean, I think COVID-19 is happening in a context where, access to safe water / clean water, access to soap for hand washing is already a challenge. So what COVID-19 does is to exacerbate some of these existing challenges. But what has happened, as my colleague who is on the call has been saying, is governments or civil society have stepped in to try to improve this kind of access. I'm looking at these women fetching water and looking at the water itself, and I'm wondering whether it's COVID that is going to be a problem or it's the water itself, because the water doesn't seem clean in any case. And while it may prevent COVID, it may create other problems like diarrhea disease and things like that. So clearly there's a challenge for many rural communities that were already disadvantaged in terms of access to safe water, and also having soap for hand washing. And COVID definitely would exacerbate what would happen in such communities.
Right. Just to throw it to Mr. Shobi now, access of water is very crucial to especially rural areas. Do you provide any safety tips when it comes to washing hands with your organization in the rural areas?
Yes, we do. Yes, we do. We actually have a health center with 3 doctors and over 6 nurses. And we've trained these doctors and nurses. In fact, the DHO and the COVID committee has trained majority of the Malawian nurses and doctors how to create awareness of how to wash hands, how to sanitize yourself, use hand soap. We've also come up with the water guard systems where we've actually added the water guard liquid in water. We have boreholes across all the villages. We've managed to put up about 1,000 boreholes within the last few weeks. And at every borehole spot, we are given sachets of water guard, and making sure that this water guards are put in the buckets and everyone has to wash their hands if they have to cross that area of village.
Right.
And those are some amazing points that Dr. Chobutunji and Mr. Jiwa have mentioned, and
Right.
seeing that many people in the rural areas, even where I come from, we do not have access to a tap where you can go and clean. So communication is also very important, and also the language that health workers or community health workers will be able to use to reach out to the community. So we're getting I'm getting a lot of comments on social media, on Facebook. Please write to us and tell us where you're watching us from, and if you have a question or a comment that you'd like to share with our experts, write them down and we'll be able to share them. We have one from David Junior Luyako, who says COVID is not going away anytime soon, and has a question, of course. How can Africa maintain its low death toll when most African countries have poor health systems? And I'll throw the question to you, Dr. Chobutunji.
So how to maintain a low death toll is a function of how many cases you get. So the first thing is how to keep the cases down, because there are some estimates that show out of the number of cases that you get, how many you expect to be severe and how many are likely to die. So the most important thing is to keep the number of infections down. And many countries are trying to do that, some, of course, with varying degrees of success. So the critical issue is about seeing how the epidemic is evolving in each country, seeing whether there are any kind of hotspots, and identifying the hotspots early and trying to contain the outbreak within those hotspots. And then lots of testing, lots of surveillance. In your introduction, you mentioned how rural areas, for instance, don't have testing sites. But some countries have gone around that, for instance, by having surveillance within all health facilities in the country, where as long as health workers are sensitized, that if you see a patient with these kinds of symptoms, alert, either the district task force or something like that, and then they'll come and take samples. So samples are being collected in many countries from across the country, whether they are testing sites or not. The only problem is that, of course, the results take longer if results are being shipped to the capital for testing. So these kinds of alert systems, surveillance, keeping track of all the acute respiratory infections is one way in which countries which don't have widespread infections can actually keep track of some of these things happening. So testing is a huge part of that, but this is complemented by many other interventions. Make sure people keep on washing hands, they keep on using masks when they're in public, enforcing the social distancing in public transport, if at all this has been allowed to happen, keeping large gatherings and those kinds of things at a minimum. So as somebody has said, I think we're in this for quite a long time, and countries are evolving how to live with it. And so you can see the easing of social distancing measures in many countries, and without the commensurate spike in cases that we'd expect. In some countries, the spikes have been there, but not in all countries. So the same measures that were taken to prevent COVID from spreading, I think these need to be sustained. And once the numbers keep down, then you'd expect that the number of deaths also will keep down.
All right, that's an interesting comment. I'll just read one of the comments here. Albino Alichkur from South Sudan says, it is indeed a very poor situation here in our rural villages. There are no even a single preventive measure being put in place. People are still greeting each other, and if you refuse, they will ignore. He says, however, we only blame our governments here for having not sensitized the communities properly. Now, for that particular question, I want to throw it to Mr. Shobi, because I know you're really involved with the community. So do you think the governments are really not providing information or sensitizing the people on the ground?
I agree with that question. We seem to have the same problem in Malawi, as our AIM organization has only particularly targeted our center where we are situated. The government has managed to create a way of communicating to the masses, as Dr. Catherine stated, that most of our areas in Africa, masses populations are in the rural areas. So the government has aided by creating and distributing solar radios, considering that Malawi has got difficulties in electricity in the masses. So solar radios has been one of the areas that has been helpful in communicating to the masses, teaching them verbally of how important it is for us to wash our hands, to keep social distancing. The radio channels have also been talking towards the age factors. As we know that the pandemic actually always targets the older age areas. So we've actually been advising a lot of the elderly to stay indoors and not come out of the houses unnecessary. So those are areas that the government has been involved in. The education system, the education department, ministries have also been doing a lot of education programs on the radios to the students that are staying at home. And they've actually been teaching them all the measures of how to wear the masks, keep social distancing. However, it is been ignored. If we see the markets within the rural areas and the urban areas, people are trading as normal. We in Malawi have gone across 500 cases of coronavirus, with already 6 deaths happened. So it is a great concern. And as you can see, I will just display our mask. This is the mask that we've actually been stitching. And you can see that we try to do a 3-layer with a filter system inside. So it's actually very easy to make. And I urge everyone to make this at home, all right, and distribute them to the neighbors, because this is some sort of prevention methods that we can do for our neighbors, for our neighboring villages, all the NGOs, all the organizations within the country.
And right, just like you've mentioned, the WHO gave guidelines on how people can make fabric masks at home. So this is quite helpful to help prevent further spread of COVID. And people should wear masks when they are in public spaces. Now, in Malawi, the rural population is 83.6%, according to the World Bank report that was released in 2018. Yet most testing centers in the country are located in urban centers. It's a question that I'd like to throw to you, Dr. Chobutunji, not looking at Malawi alone, but Kenya. There's so many African countries where most of the testing for COVID-19 is in urban centers. What do you think the government can be able to do to be able to put in place testing facilities in rural areas now that we're witnessing a lot of widespread transmission of COVID?
Actually, I think the testing strategy for every country should be guided by the stage of the epidemic or the phase of the epidemic where they are. And because it's not practical for many African countries to do mass testing that has happened in other countries for different reasons. The biggest one being that testing materials, the consumables needed to conduct the test are not widely available, and African countries are struggling actually to get enough materials to do tests. So in the face of this shortage, many countries are doing what they call targeted testing. And so you test because you expect to get results from that test, or you test because you think there's high risk in that subpopulation, or things like that. So rural areas, in the way, it may not be a problem if there's not widespread community transmission within the country. And even countries that have widespread community transmission, even that widespreadness is within urban centers that are outside the capital, but not necessarily in the rural areas. But Kenya actually is one interesting one, because Kenya, I think at the last count, they had 20 sites that are spread across the country that can test, which is quite unusual, because many countries are collecting samples from all over the country and taking them to a centralized point for testing, most of them within the capital. So we've had, for instance, Ghana, they're using drones to transport samples. Uganda, they have a whole network of motorcycles. I don't know, I think they said like 700 motorcycle riders or something that are collecting samples from across the country. So where the location of the site itself may not be a problem, especially given how the transmission pattern is in a specific country, as long as the people who are suspected or the people who are at high risk, it's possible to collect samples from them, then testing can still happen. But of course, the nearer the testing site, then the faster results are to be received. And that can be a difference of one day can be important with regards to how many interactions the person will have had before they get their results back. So I think countries, in the absence of infinite resources, countries have to be pragmatic in how they spread their resources with regards to testing. And I think as long as there's a network where samples can be collected, as long as there's a network where suspected cases can be tested, then it's not so much that you have physical facilities across the country, because in some cases those facilities may be redundant, and you don't want to waste redundant You don't have redundant facilities, and yet you don't have enough, resources to do the testing that is needed in the country.
Right. I guess it's a joint effort. Well, now we spoke to the chairman of Malawi National Task Force on COVID-19, Mr. John Puka, and asked him what the government is doing to ensure the rural population gets tested. Listen in.
So although we have centralized at district level testing, once we have a suspect, the samples are collected through the surveillance system that is all the way to the villages. Surveillance is watch over. So the system is that all those at present that have suspicion of symptoms or either fever, cough, and so forth, should really report to the nearest facility. But largely, we're also promoting them to call a specific phone number so that we don't also encourage the spread. So once they call into this number, they are supported by the HSAs within the district, with the district response team that actually visit the household of this person and then collect the samples. So we have a setup that is inclusive of affording testing even to those that are in the villages.
Some strong points coming from Dr. Fuka in Malawi, and some of the comments that you're getting from Facebook. We have one from Geoffrey Musyoka from Kenya, who says that we've been washing our hands, sanitizing, etc. The only challenge is the fear of infected who escape from quarantine facilities.
Right. There's also another interesting comment from Ibrahim Garbakuta from Nigeria, and he says there's negligence in safety measures in cities, talk more of rural areas. That is hardly to believe COVID-19 is real. So, Dr. Chibutunji, what do you think of that?
I think there's been a criticism about the measures which have been taken by African governments, which in a way is justified, but perhaps in another way not entirely justified, that there was hardly any consultation with communities about some of these measures which were taken. And one can understand why this happened, because it was quite urgent. Governments needed to act fast and do these measures, because otherwise we could end up, being like Italy, where the whole healthcare system was overrun. But then, having said that, many countries now have passed 12 weeks, 10 weeks. They're in the third month or the fourth month of the outbreak. And so I think there's an opportunity to pause and consult communities and get, their input in some of these measures. Because people are people. They are not, they are not children that you're going to just make orders and people will follow orders. People need to understand why they need to follow these orders. They need to tell you why they think this is not going to work. Maybe they need to tell you what they think is going to work better than what you're saying. So I think countries have an opportunity to pause a little bit and get input, because the reason why compliance is very low is because there was no consultation for different communities, for different sectors into some of these measures. The other issue is that without mitigating the economic impacts of social distancing measures, people can't stay at home and starve. So actually, there's an incentive for governments to provide economic relief for small businesses, economic relief for people who have no jobs and have no employment, because in a way that is an incentive for them to comply. If people are starving, they're not going to stay at home and observe social distancing measures. But if they have food provided by government, they're more likely to be compliant. So there are two things which can be done: provide some kind of economic relief, but then also take time to listen and see how to customize these measures to the African context.
Right. I just want to bring in Mr. Shobi. Do you actually think that rural areas don't believe there is COVID-19? Because that's what Ibrahim was also trying to address.
Fortunately, I agree with Ibrahim. When we have had challenges to actually access to the villages, when we try and explain what COVID-19 is, we have a lot of responses that no, there's no such thing as COVID-19. We don't believe that there's such COVID-19. It cannot come to Malawi. It's something that has happened out of the shores of Africa. And there's a stigma of ignorance. And I also agree with Dr. Catherine in terms of how The Malawians, especially the 83% that you mentioned, they earn less than $2 a day. So, I mean, for them to stay at home without food would be a great challenge. Hence why they need to go and get the normal relish. Not only that, the vendors, who are the prominent areas of business people in the country, they need to go out and obviously sell what they need to sell to earn the daily bread. So there is a lot of ignorance in the rural areas. Not only the rural areas, I agree that there's ignorance in the whole country, especially in the urban areas that has more of a bigger, wide variety of educated people. But trading is still going on. Corporates are still functioning. The business people, everyone is still going to work. Markets are open. And yes, there is some sort of practice in masks and social distancing, but it happened more when the pandemic was more freshly active. But as we go into more cases, I can see that the awareness is slowing down. And people are just going back to the normal routine of living normal lives.
All right, then. So what are you doing to create that awareness, to make it more, out there?
Well, as you're aware, Malawi is currently going through the second election, the presidential election. We had an election last year, and the courts have overruled to have another election. So the political parties have been doing a lot of campaigning in the rural areas. Part of the campaigning, a lot of this political parties are also advising and using these campaigns as mere education to educate the masses of the pandemic crisis, advising them to wear masks, advising them to wash hands, advising them to have social distancing. But if you see the campaigning, there's masses next to each other and thousands of people, all right, that are not compliant with these advices. So we can only do a certain bit of our part of actually trying to create the awareness through the ministries and through the chiefs of the villages. But with the current situation Malawi is going through with the election, it's very difficult to control those areas.
Right.
And I think I'll go to you right now, Dr. Chobutunji, listening to what Dr. Fuka has mentioned of how they're reaching out to communities, especially those living in rural areas, and how Dr. Jiwa has also explained the importance of sensitizing the community. What else have you noticed? What else have the researchers at APHRC noticed when it comes to reaching out to the rural population and sensitizing them about COVID-19, with now many countries starting to ease lockdown restrictions?
I mean, what I can say generally is that African countries have different healthcare systems or different systems, and they've effectively mobilized those systems. So COVID is not happening in a vacuum. And so there've been existing systems. In many countries, there are community health workers. In other countries, radio has been used quite effectively to launch campaigns around vaccinations and bed net use and things like that. So countries are repurposing most of these systems. And to a certain extent, they are effective as far as they're able to communicate. And I think I would say that people don't misbehave because they don't know what to do. They misbehave because maybe they've not been given alternatives in terms of behavior, and perhaps the rationale for what they're being asked to do is not clear to them. So there's a lot that can still be done with regards to, as I said earlier in my earlier point, getting the input of communities so they can understand this is what's happening. However, this is what you can do yourself. So people don't need to be told what to do. They need to know why they're doing it, and they need to be supported to do that. Because human behavior is not just a function of what people know, it's a function of the systems that exist to support that behavior. So there's a role for enforcement, a role for further consultation, a lot for community leaders, a lot for church leaders and other religious leaders, and many others. So it's still a long way to go, and we still have to come together and figure out how to do things better than we have in the first few months of the outbreak.
Right, interesting comments from Dr. Catherine. Now, Richard Tanui from Kenya says Africa this time round is not leading from behind in precautions against COVID-19. Quite a Interesting comment. What do you think?
Yeah, it is very interesting. And we also have Jos Bex Masakera from Uganda, who says that we need to practice frequent hand washing if at all we have to contain COVID-19 from spreading. And from some of the points that we've picked from our two guests, thank you so much for joining us. The importance of learning how the virus transmits, how to protect yourself from getting COVID-19, and also governments ensuring that they need to beef up their alert systems and ensuring that also hospitals are well equipped, not only in urban but rural centers.
Right. So we want to appreciate your participation on this BBC Africa COVID-19 discussion. Thank you for sending your questions and comments. We hope you got something valuable out of this.
Thanks to our guests, Mr. Shobi Jiwa from Malawi and Dr. Catherine Chobutunji from the Africa Health Population Research Center for joining us. My name is Rodo Diambo.
And I am Fatia Mohammed Noor. Thank you for making time, and our partners who have been taking the show live. Thank you.